illustrious career at prestigious institutes, Babuji Dental College, Davangere, Mahatma Gandhi Postgraduate Institute, Pondicherry, and Raja Muttaya Dental College and Hospital, Annamalai University, prior to assuming office in March 2013 as the principal of Indira Gandhi Institute of Dental Sciences, Pondicherry, a constituent unit of Sri Balaji Vidyapith. Brief exposure to educational administration as well as her training in health profession education inspire her towards the quality dimensions in health profession in education, and by the grace of Almighty she has been bestowed with the responsibility of holding the post of director accreditation and coordinator of IQAC at Sri Balaji Vidyapith since 2019. She believes in continuous learning and in learning through sharing. Participants can put your questions in chat box. Madam, the stage is yours for the presentation. Madam, you can share your slides.
At the outset, a very good morning to one and all, and thank you very much for that lovely introduction. And thanks at the outset to the organizing team from Vinayaka Mission Dental College, the principal, as well as the director of the university for having considered my name for this topic. So I will be sharing my presentation. Let me know if you are able to see it. Are you able to see my screen? Hello? Hello?
No, ma'am.
Your lines are frozen, actually.
You can share, ma'am.
Just a second. Now, can you see?
Yes, ma'am.
Yeah.
Can go full screen, ma'am.
Yeah, 1 second. So you can see the full screen?
Yes.
Yeah, okay, right. So happy morning to one and all, and we bring warm greetings from Sri Balaji Vidyapith Internal Quality Assurance Cell. As just like you, we are a health sciences deemed to be university. And the motto of our university is to endeavor to love well-being everywhere. And IQAC, with its motto of acting with perfection, or as it is said in Atichudi, Sevana Thundachai, and that is the motto that we follow in IQAC. Assist SBB achieving its goals, vision, and mission, where we follow this concept of where quality is not an act, but a habit. So the topic given to me today is quality assurance in health professions education. And what I'm going to start with is a lament. This is a usually quoted or most quoted or cited statement in most of the quality related articles, which is given by Percy, who's the author of Zen and the Art of Motorcycle Maintenance. So he is totally confused about how do you define quality. Is it existing or not existing? We know that it is existing, but how do we define it, etc. So this one is something which happened in 1974. That is not very long ago. So when there is still a confusion that is existing in defining quality is the essence of this particular lament. So going on to the definition of quality. So as you can understand that quality is very difficult to define, and especially taking the concept from the corporate setup for the companies and fitting it to the health professions education or to the higher education, there has been a big challenge to define quality in education since 1930s. The reason is they say that it is a very elusive concept, not very tangible to be measured, and it's a very subjective concept. And it is also known that it is a multi-dimensional concept, which is difficult to be captured in one small definition, and a very dynamic concept. And it is very perception-oriented, like stakeholder-driven. What is quality for a student is not a quality for a teacher. So something like that. And there is also a contextual difference. What is cost effective for me is quality. What is really quality, even if it is expensive, is quality for the other person. So it is a very contextual matter as well. But what I have understood, sorry about that. So what I have understood, what quality is not. Anything that cannot be defined cannot be quality, especially in our area, in education. We cannot define it, then we don't have an option of assuring it. So you cannot do a quality assurance if it cannot be defined. So it is important that we quantify or define quality. So coming to the definition of quality, there are a number of articles which actually try and define quality in higher education. This is one such article which had actually taken a lot of quality definitions and tried to synthesize what would be the best for the quality in higher education definition. So they have given that it has to be accountable, a purposeful, transformative, and exceptional aspects in higher education are supposed to be quality in higher education. What is the meaning of accountability is for delivering zero defect education products and services. Being purposeful is to align with the stated vision and mission, accrediting all the statutory bodies. Being transformative is to effect positive changes in the personal and professional development of all the stakeholders. Exceptional meaning that we achieve distinction and exclusivity through very high standards. This is what is the definition given for the quality in higher education. And this is arrived as a conceptual model based on various definitions and concepts given in the literature. But when it comes to what is quality in health professions education, because higher education, yes, we are higher education universities, but we also focus on health sciences. So we call ourselves a health profession education universities. What is different for us, or what is the most important thing that we have to follow as quality? So there, one thing that comes to my mind is professionalism. So what we want is our graduates, when they come out, they have to be excellent professionals who have this virtue called as professionalism, which is nothing but it is defined as the habitual and judicial use of communication, knowledge, technical skills, clinical reasoning, emotion, values, and reflection in daily practice for the benefit of the individual and the community being served. So this is what we have to have at the end of the day when we send our graduates outside, that they are professionals. Right? If you look at the 21st century, if you look at the 21st century health professionals education's competencies, what they should acquire before they leave our universities is that they have to have 5 core competencies. The first one is, of course, they have to provide patient-centered care, and they have to work in interdisciplinary teams with all sorts of health professional teams, and they have to apply quality improvement in their day-to-day practice, and they have to use informatics as much as possible using the ICT and the technology, and they have to be able to have an inquisitive mind or an inquiry-based learning, that they employ evidence-based practice. These are the 4 or the 5 competencies that they have to acquire. Now, these 2 slides, personally, I believe in a concept called as KISS, that is, keep it simple and straightforward. So I have understanding that I should be able to produce a physician or a healthcare professional who I would like to see if I'm sick. This is told by Dr. Malenkov. So the goal for me personally is that I don't want to go to one of my graduates who have turned out to be like this. So the goal of the university must be that I have to produce a healthcare professional whom we all would be able to go and see if we are sick. And that is the simplest definition of what kind of a quality we expect in our graduates when they leave us. So there are a few buzzwords in quality. Just reduce this. There are a few buzzwords in quality before we go further. As of now, what we had seen is the term quality, how challenging it is, what is quality in higher education, and what is quality in health professions education, where we said that we have to inculcate the concept of professionalism in our graduates. Before we take the discussion further, there are certain buzzwords in quality which we have to observe. or learn so that it is easy for us to understand further. Now, I'm sure being a university who has gone through this NAC process, everybody would be aware of these terminologies. But as I said, I want to keep it very simple, and the way I have understood these concepts is what I'm going to share with you. And these are something which the quality gurus in the internet have quoted. So let's say that good health is our goal, that we want to have the maximum good health. That is our goal, right? So what do our doctors see, or what we see for ourselves is maybe these parameters: blood pressure, body mass index, or sugar, or cholesterol. These are the few parameters which we may see, monitor, and correct, intervene, and ensure that we reach the good health. Okay, so these are called as the key performance indicators, which is going to constantly tell us whether we are moving towards our goal of obtaining good health. That is the concept of key performance indicators. If you take each and every one there, that is sugar or BP or body mass index or cholesterol, they're all called as metrics. So that is what is given in our NAC manual, that we have key indicators and we have multiple metrics inside. Now comes the target. I have set a target for my sugar level that I have to have my fasting sugar within 100 in 1 week. I have set up a target for my weight that I have to become 65 kg within a month, right? These are called as targets. Now, if you see that the targets are given only for the metrics, these are not the targets given as a goal. So sometimes we tend to get confused between the goal and the target that we have set up for our metrics. For example, if I have my sugar under control, but I did not bother about my cholesterol, that is not called as good health, right? So good health is the goal, which is actually constituted by multiple parameters. Those parameters have to be objectively monitored by using key performance indicators. And the metrics are the ones where you will fix the target. So these targets have to be SMART. As you all know, it has to be specific, measurable, achievable, relevant, and time dependent. So as you can see in the target of fasting sugar, I'm saying that within 1 week, I have to get this value. Target of weight, I'm saying that within 1 month, I have to get this value. So it's a measurable target which we have to fix for the metrics. Now, I want to achieve my target for these metrics by walking for 1 hour a day, starting long-acting insulin, or going on a crash diet, right? These are called as strategic actions. So these strategic actions are actually working on the targets and trying to improve them. Then we have a wonderful concept called as benchmarking. Where do I get the target from? The target for this particular example is because that is the health standards that we have, right? So it's easy to fix a target. But when you have to fix a target of, I want this many number of publications, these many funded researches, where do we get it from? So you have to start comparing yourself with the other organizations outside. That is called as benchmarking, looking at their best practices. As it was mentioned, as it was just now mentioned by the director, that you have to start looking at the best practices of the other universities and institutions. This is not called as copying. Usually we say that we tend to copy from the other university. It's not called as copying. It is closely observing how did they achieve this which we could not achieve. What are the parameters that help them achieve which we do not have? So the targets that we derive from these benchmarking will differ from university, and it will be dependent on the structure and composition, goals, vision, and mission of our respective universities. It cannot be the same. So that is why we have to see the benchmarking. And all these things are actually governed by the vision and mission. As stated again, the vision and mission for every organization is different. So right from the goal to your targets to your strategic actions, everything will be tailor-made based on the vision and mission. Those are the guiding lights for the entire university to set these parameters. So it cannot be the same for all universities is what I'm trying to tell you. So having said those, talked about those buzzwords, now we are going to see what are those magic ingredients which makes the magic potion of a health professions education or a higher education institute which concentrates on the health sciences. The structure of the HEI for HPE These are the heroes and heroines, the learners who are the center, the most important stakeholders we have. And we have yet another important stakeholder, that is patient, which actually for this presentation, I'm not touching much about it because of the lack of time. So I want to keep it very brief. So the most important stakeholder we have is our learner. Of course, we have the academic programs, and we have a concept of how do we deliver these academic programs to our stakeholders. And as stated by the director, the most important component of any higher education institution, including health professions education, is the research. And then we have a concept of educational environment. I'm not talking about the infrastructure here, but I'm talking about a holistic ambience provided for the growth of all the stakeholders inside the university, that is educational ambience or educational environment. And yes, of course, we have the overarching leadership or governance, which is taking care of all these aspects. But what is interesting is that any university can be considered as an open and a dynamic, conducive system of education, must have feedback taken from the stakeholders. So it starts from the bottom. So it's a bottoms-up approach, and any kind of policy decisions or implementation has to happen from the top down, that is from the leadership aspect. But this is a two-way communication. It's never one way. Only then a continuous quality improvement can happen in an educational institution. And this particular interaction is actually a very dynamic interaction. So now touching upon the academic programs, what do you consider as a qualitative academic program, a good academic program? Everybody has gone through the NAC manual, but what we need to know is whether our programs are need-based or relevant, or have we just started it because institution A, B, C has started it. So we have to look at contextually, regionally, whether the program that we have started is need-based for the public, satisfies the need of the public in general, specifically, nationally, globally, etc. Whether it is relevant. Okay, and this is the most important thing, that the program should be focusing on the competency and skill development so that the graduates are offered employment immediately. They have to be unique and innovative, and they have to be an updated curriculum with constant updation with syllabus revision, taking into account the feedback, etc., etc. And otherwise, we'll end up in ossification of the curriculum, or they even call it as fossilized curriculum. So that should not happen. And well-defined learning outcomes must be there, which is constantly mapped with the program and course objective, and also with the program education objective. Obviously, it has to be flexible, as it has been said in the NEP 2020, that it has to be a flexible curriculum with multiple entries and exits, choice-based credit system, electives, etc. And they have to be enriched with value addition in terms of other courses, value-added courses, or in terms of learning experience provided outside the campus. And of course, it has to be integrated and interdisciplinary, which is again being emphasized by the National Education Policy 2020. Now, in this, there is one point which is raised by the director stating that being governed by the statutory bodies, how much of liberty we would have in being innovative or unique or keep updating our curriculum. Definitely, yes, there are restrictions. At the same time, any of our in our health proficiency education training, we are given all the 4 NMC curriculum, DCI curriculum, and we actually go through the process of identifying how much of freedom we have. And we did realize that we do have certain amount of freedom where we can make it unique and innovative, introduce certain concepts which are possible to introduce within that time frame. It is not a very rigid and a mandatory curriculum is what we realized. And I think it is possible provided we have a little bit of creative thinking. And of course, it is easily possible when we have other non-statutory programs under us. It's very much possible to be very unique and creative and innovative. So what is quality in program delivery? I have divided this into 2. One is about the facilitators, that is our teaching faculty, and the other one is about facilitation, like how do we teach them, the teaching learning methods. So the first aspect, the facilitator part, we know that we have to have adequate faculty. So we have to have an optimal faculty-student ratio ranging from 1:10 to 1:15. And every one of our faculty should be academically qualified, yes, especially if they have PhD or other higher degrees, have got a lot of awards for their scholarships, and diverse, the most important point, because if you look at a student cohort, we are promoting diverse student cohort now, which means in order to handle them, the faculty also have to be diverse, coming from different parts of the country and coming from different countries as well. And professional experience, no doubt about it, but a good university would have, as it is asked in NIRF, if you all know that they ask for an equal proportion of faculty with more than 15 years, 8 to 15 years, and less than 15 years experience. What is actually expected there is every institution should have the wisdom and the expertise of senior teachers, and also have the energetic and innovative thinking of the junior teachers. And that's the kind of a blend that is expected in professional experience. And every one of our faculty should have the urge or aspiration to continue towards professional development by attending a lot of professional development programs, faculty development programs, etc. And they also have to actually satisfy the multiple roles of the teachers, like curriculum or content developers, researchers, mentors, guides, etc. Here again, it was pointed out in the introductory remark that the teachers hold multiple roles. It is not only for us, it is there for entire globe that the teachers have to actually be practicing 12 roles. Okay, so these 12 roles, they have to know how to balance. So one tough aspect we have is research, which I will try and touch when we talk about the research part. So now comes the facilitation part. So in facilitation, that is teaching learning methods, a good quality university should be practicing student-centric teaching learning methods. And we know that it is something to do with small group discussions, near-peer teaching, or let's say problem solving and case-based learning, inquiry-based learning, role play, etc., which is all there listed in our NAC manual. In fact, after going through the NAC process, I feel that if we follow each and every content of the NAC manual, we would be able to take our universities in the right direction. And then, of course, the teaching learning method should focus on the students with different learning capacities and provide strategies specifically for them to improve upon. Inquiry-based learning, so we are focusing on undergraduate research also has to go up in a university, so we are focusing on that. Competency-based and simulation-based training and objectivized and transparent evaluation and assessment must be there in the university to have a quality program delivery. Now coming to the quality of the learners. But what comes in should be good. So what is more important is that we have an entry-level requisite, which is very good. So for example, let's focus on a NEET score. As of now, it might not be there under our control, but once you become a very popular university, the entry-level students would be better because your NEET scores of the students would be better. But even otherwise, the admission process, if it is made stringent and quality-based, then you might get good students. And once we recruit, admit the students, we also have to ensure that we have adequate access to all kinds of marginalized population, including the transgender population, which SBB follows. And we also have to provide the equity in terms of socioeconomic status as well as the gender. And there have to be a diverse set of students from across all cultures and region and even international. So that indicates a good quality inside the campus. And of course, our students have to have an active academic engagement. They have to be self-directed and deep learners, not superficial learners. And most important is about the progression. What is their exam outcome in the summative exam? And have they acquired enough competency that we set for them? And have they progressed successfully in their profession towards higher education or towards placement? Quality of the research, a tough area. First and foremost, I would like to answer the question which was stated in the introductory remark that research is considered to be tough for health sciences profession, mainly because of the time factor, because we handle patient care and teaching the students. But research is an inherent part of every organization, whether it is arts, science, technology, or health professions education. So a research ecosystem must be set up in the university, which actually encourages the faculty, gives protected time to the faculty, provides all kinds of facilities, facilitates the research. In fact, we in SBB, we are also trying to focus on the undergraduate research so that the research ecosystem spreads even to the last stakeholder in the university. So you have to have facilitating policies. They talk about incentives, increments, etc., based on your research and publication. But what I would like to say is the university would be successful once it is internally motivated the faculty to do research and publications. It need not be dependent on an incentive or an increment or a performance appraisal or a promotion. So it has to be an internal motivation that every one of us must contribute to the knowledge content of India by way of research. This is knowledge generation, and knowledge dissemination is the responsibility of each and every one of us. So it should go beyond that level of facilitating policies such as incentives. Of course, if we have a lot of funded research, clinical trials and consultancy, we are considered to be good. Here it is a tough competition for all the private universities. Definitely, yes, getting a funded research from a private university is very challenging compared to a government institution, especially an institution of national eminence. So we do have issues, but we can always focus on the clinical trials, which is actually something we can do, an engineering college cannot do. Consultancy, yes, so we can focus on these areas. Research collaboration, the more and more we collaborate with government organizations or with international organizations, the challenge that we have in funded research can be overcome. Professor S.P. Tyagarajan recently gave a lecture on the quality of research. He said one main parameter which can be reflected upon by research in a university is the PhD program. How well the PhD program is happening inside a university is a quality indicator. Index publications must be the outcome of the research papers, research work. So it has to be indexed. That is a very challenging area. This particular slide, it should be a separate webinar because it has a lot of challenges embedded and a lot of solutions are possible. So we have to talk to here. What matters here is benchmarking. So here we have to benchmark ourselves with the universities which are actually doing very well in these areas. Talk to them, identify their best practices, and try and implement them here in our universities. One example I would give is, supposing that one university is publishing 2,500 papers in a year, right? And we are publishing 500 papers in a year. Now, I cannot say that your target for this year is 2,500 publication. It doesn't work out because you have to start looking at the ecosystem. You have to start looking at the number of people who are there dedicated to research, number of facilities we have. So while taking that into consideration, you can say that from 500, maybe we will have a target of 750. That's a measurable and a smart target that we can set up for our faculty, rather than setting up a faculty comparing to a university which is long-standing, which is a university of national eminence. We cannot set a target. So the targets, this is where benchmarking comes. And if at all we have a problem in this area of research, I think benchmarking should be the right strategy to follow in research. This is one area which is not, which as health professionals, we had never been exposed much, but people have started talking about the intellectual property, startups, technology transfer, etc., which are all concepts which are very popular in the engineering side, technology side, but not very popular in health professions. I think we have all started waking up to this concept, and we now realize that there is a wonderful opportunity to contribute to intellectual property of India, because India is right now promoting so much. So in terms of Startup India, in terms of Make in India, even IPR, they have a lot of facilities to even encourage the undergraduates go through the patent process. So at SBV, we have actually succeeded in the last 3 years to make a very good progress in this area just by taking initiatives, strong initiatives, and now it's almost like internalized culture of SBV on IPR, startups, and technology transfer. Now coming to the quality of the ambience, here the environment, as I said, I'm not talking about the 5-star or a 7-star infrastructure. But I'm talking about an educational environment which provides safety and security and a holistic development of the student in all dimensions of curricular, extracurricular, and co-curricular activities. Of course, infrastructure is important. And of course, you have to provide as many learning resources as possible, not only books and journals in the form of hard copies or in the form of e-copies, but also learning resources in terms of patience and learning resources in terms of community exposure. If all these things are there, we consider it to be a quality educational environment. And the students have to be provided financial support, career support, and a safe and secure campus with a very efficient grievance redressal mechanism to save them from dragging, sexual harassment, etc. And you have to have value systems embedded at every aspect so that they emerge as global citizens. So if you know the Maslow's hierarchy of educational ambience, at the end of the Maslow's hierarchy is self-esteem and self-actualization. That's the kind of an educational ambience that we have to provide for a student. So it is not just about infrastructure, how well the infrastructure is utilized, how safe and secure, how well we take care of the mental and psychological aspect of a student, as well as the faculty, not just the student. Finally, we talk about what is good leadership or good governance, a decentralized and a participatory governance. As I can see from Vinayaka Mission Dental College is actually hosting a program as an IQAC, that is decentralization. You have a central office of director of quality, and then you have every institute of yours maybe having an IQAC, and a program is being done by them. It is totally a decentralization. So this kind of a decentralization and participatory as well, if it is there, that's supposed to be a quality leadership. And it has to have a lot of policies and standard operating protocols to guide each and every process, so that though there is a decentralization, there is also a standardization that will speak about the core values of the university. Decentralization doesn't mean that all of us work in different directions. Decentralization means that you're given the autonomy within the values of the university. That's why the policies and SOPs are important. And as I said, bottoms-up approach based on the feedback from your patients, from your students, from the parents, from the society, all these things, if it is included, making these policy decisions is the best leadership. We have to inculcate as many values and best practices as possible, so that the university has got one distinctive area in which it constantly improves its quality. For instance, as far as SBV is concerned, we are focusing on our distinctiveness on our services to the transgender care, right from surgical care to a holistic support. So those kind of distinctiveness have to be identified, and the governance have to start focusing on that. That's a kind of a contribution to the society. Finally, this cannot be ruled out. That is, you have to have a proper planning, execution, monitoring, and constant continuous improvement through robust internal and external quality assurance mechanisms. Without this, the leadership cannot be called as a quality leadership. So far we had seen what constitutes the entire higher educational institute, and how do you say that it's a good one or a bad one. I've told that in a very simple way, but you all are exposed to NAC, and they go into the sub-parametric meters in terms of metrics, etc. So kindly don't consider this is my understanding, that's it. So it is not a very elaborate way of saying that this is a good quality university and that's a bad quality university. So it has to be studied in depth. And as I said, I have left out many parameters in which I had discussed. Now, this particular thing, defective product. How many of us say at the end of our teaching, end of the exam, say that if a waste piece, terave tera, we say that in Tamil. How many of us say that? Many of us do say that at end of the 5 years or end of the 10 years, we say that the student is a waste. He cannot improve. This is a bad student. That is done at the end of the program, and that you call it as quality control. This quality control is indeed an important thing. Like for example, at SBV, we have a concept called as exit competency assessment exam. So the students who are leaving internship are assessed for their competency assessment. But I can do that provided I had taken measures to improve their competency right from their first year onwards. If I had not done that, I don't have any right to say that this is a defective piece, right? So quality control is needed, but I don't want to have these defective products. So quality assurance is what is more important for us than quality control. Quality control will come as a subsequent measure to quality assurance, but that will not be the primary measure. So exam outcome, for example, you take, you know that one student is failing number of times, is a defective product. But why is he failing? What was his status when he joined? That's where it comes, the learning levels, like how, whether the student is a slow learner or an advanced learner. That measure we take in the immediately after the student joins the program, then we would have taken some corrective measures to make him into a better student, right? So that is the process. So this entire quality assurance is called as a process. It is not the end product. Now that's the difference between quality control and quality assurance. So if you see this slide, quality assurance focus on the prevention of defect, and quality control will focus on the identification of the defects. I don't want to identify the defect at the end. So I want to focus on the prevention of the defect. It's a proactive process, and quality control is a reactive process. This is process-based approach and this product-based approach. And this manages quality and this verifies the quality. So what I need, or what we all need for our university, is quality assurance, not quality control. Of course, it's needed, but at a later stage. And quality assurance, because ours is a high-stakes profession. There are lives of the patient in the hands of our graduates. As I showed you in the first slide, that I don't want to go to a dentist who's a killer, right? So that is a high-stakes profession we have. So it is very, very important that we take quality assurance very seriously, and it's a day-to-day process which must be understood by each and every faculty of a university. So to define what is quality assurance, it is policies and mechanisms to ensure that we are fulfilling our own purposes. So as I said, you would have fixed that I want this to happen at the end of the year. So it is one process that will identify whether you have reached that goal that you have set for yourself, or whether we are meeting the standards that apply generally to all the higher education institutions, or are we meeting the standards set specifically for that profession or the discipline. So that is what it is. So you have to have policies and mechanisms. The moment I say that policies and mechanisms, you can understand the role of the leadership, the governance here. So without that, quality assurance cannot happen. And as I say this very frequently to everyone, that quality assurance is not just IQAC's responsibility. To staff and attender until the level of our vice chancellors. So you see, usually, you know what IQAC is depicted as data collectors. You know, we chase behind data. The moment they see us, they run away because they think that we are there only to collect data. Actually, no, the data that is collected is analyzed for quality. And that is what is the responsibility of the internal quality assurance cell. So that quality analysis is the one which has to be projected in terms of what is to be done next, what is to be corrected next, what is to be sustained better. So that is the job of internal quality assurance cell. But internal quality assurance cell may be a 30-member team or a 10-member team or a 50-member team, but it is actually 3,500 students. If you have 5,000 students, it's the responsibility of each and every student as well. So it has to be a culture that has to be imbibed in the entire campus. As I said, it is a continuous process. You would have understood that it is a continuous process with periodic audits have to happen. It should have an internal assurance process and an external assurance process. It can be both quantitative assessment or a qualitative assessment. You have some tools for assessment. Ishikawa has given 7 tools for assessment of quality, which I'll be talking in the next few slides. Identification of the right key performance indicator. One of the most important aspects of quality assurance is what is it I'm going to measure? What are the parameters I'm going to measure? So unless you identify the key performance indicators, you might not be measuring the right progress or the right problems. So you end up confused. So you have to have an identification of the right KPI. It need not be too many KPIs. It need not be too less KPI. It need not be a diffuse KPI, etc. So there is some parameter for a right KPI. It has to be relevant, which is understood. It has to be reliable. Whatever data I get out of an analysis of a key performance indicator must be a reliable data. And I should be able to cross-verify, audit it, etc., scrutinize it. And it should be a transparent data which I can share with my higher-ups and to all the stakeholders as well. And it has to be a current data. It has to be applicable to that point of time what you're analyzing. So these are some of the 5 parameters that you have to take care when you set your KPI. I wanted to give only one example on how we go about setting KPI and strategies. In fact, you might be having it, but you see if this one will help you. For example, the goal I have is excellent student outcome and progression. That's my goal. So what I have here is, I have a target that by 2023, 100% of the students must pass within stipulated time. No supplementary batch business. Everybody must pass. 90% of the past students must be going for higher education or placement immediately. So in that also, we are giving a specification, 70% towards placement and 20% towards higher education. Within 1 year of graduation is my target. Now, I can have strategies. I can have these strategies that I have to identify the slow learners well ahead of time before they become disastrous failures and take corrective actions. That's my first strategy. I would establish a placement cell or an entrepreneurship development cell. We can provide NEET training for the students, or English language training, or PLAB training for the students. We can have career counselings, campus interviews, job fair. These are my strategies that I would like to implement to achieve my target by 1 year, that is 2023. Now, what are the key performance indicators that I will use to assess whether I am achieving this goal or not is this. So I would take the percentage of students who are admitted and compare it with the percentage of students who are passing. These are concepts from NIRF, number of students admitted, number of students passing, and minimum stipulated. Then I can also take percentage of students passed who are progressing towards higher education, percentage of students passed progressing towards placement. So I have only 3 key indicators here, which will exactly tell me where I'm progressing, where is the university progressing, are we achieving the goal or not. There is a possibility that we overachieve it, within a short time. Within 6 months, you will achieve everything. That is also possible. So you relook at your targets, relook at your KPI, and see whether you can add more KPI to it. For example, in the students placed in placement, I can now start looking whether my students are getting placed in international organization, not just national organization, not coming back to my own institution, So these are the concepts which are dynamic. So even the choice of your KPI is dynamic, and the choice of your sub-parameters inside the KPI is also dynamic based on your progress. So this is only one example. So we can make multiple sheets like this so that we can start looking at each and every individual parameter in this manner. So we have the process of internal and external quality assurance audit. So in a year, you take a calendar year, you can have frequent audits, like it can be a 3-month audit or it can be a 4-month audit. And these audits will be looking at certain parameters which you have set up. Let's say that at SBV, we have a departmental quality audit, which happens every quarter. So we will have 4 audits in a year where we start looking at the progress of the departments. After setting the targets, we see whether they are able to reach their target, etc. You can also have one ISO audit. ISO is mandatory for all the universities. So ISO audit, there can be some internal audits happening. They say that minimum 2 internal audits are required for ISO. Of course, you'll have your surveillance audit added to it. And academic and administrative audit. At the end of the year, academic and administrative audit, if you do, you will get the status of what is happening in the institute. in the university, have we achieved or not? And here you can have external members, and that would be called as a peer team visit. Similar to our NAC, we'll have a peer team visit who will do the academic and administrative audit. Yes, of course, feedback and satisfaction surveys, if they are conducted periodically, throws a lot of light on where we are and where we have to go. Accreditation happens once in 5 years or once in 7 years, right? So we don't have to wait for that to happen to start looking at our quality process. So that is, to my understanding, I would say that accreditation would go on very smoothly if all these processes are happening on a day-to-day basis. So we don't have to really work hard just for the sake of accreditation. But you look at the motive of NAC for accreditation, they're actually saying whether this institution is standing up to the mark which is set for a higher education institution. And that is what NAC is saying. But the process that we go through, it is not just a 1 month preparation or 2 month preparation, not even 1 year preparation. The process is dynamic. It has to happen every day. So finally, I'm now coming on to the 7 quality assessment tools. So we are all researchers, we are all teachers. Many of these statistical tools we all know, but I'm just going to show a few examples how these 7 tools of assessments can be used for the quality assurance, especially taking into consideration some of the quantitative data. The first one is a cause and effect diagram. The second one is a check sheet. Check sheet I'm not focusing upon. Control charts, histogram, Pareto chart, scatter diagram, stratification I am not focusing in this presentation. So these are the 7 tools given by Ishikawa. And I'm told that the stratification is sometimes replaced by a process flow chart, which is also very easy for any health professional to understand. So I'm not including that in the discussion. But how these tools have been used by us at SBV to understand certain concepts is what I'm sharing with you right now. So this is, sorry. So this is a cause and effect diagram, also called as a fishbone diagram, also called as an Ishikawa diagram. And this diagram I've taken from a journal, an article where the authors are trying to mentor the students who have chronic absenteeism. So before they start the strategy, they are looking at the problems. What can be the problem? What can be the reason for these students being chronically absent for the classes? So they have taken the major reasons here as health of the student, lack of connectedness, school climate, negative student behavior, academic issues, and family challenges. Inside that, they are looking at what can be the sub-causes. So they are saying health of a student can be a physical cause, mental cause, emotional cause, substance abuse. So when they do this, they would know and identify what are the causes, majority of the causes that are actually causing this problem. So they can start looking at the strategies to correct these causes. So that is what is the use of the fishbone diagram. Coming to the graphs, everybody knows in and out, we know as researchers where to use what graph, but we have used certain graphs for projection of what the status. One line diagram shows the trend analysis, right? So we have used this to see the applications received for our allied health sciences programs. How many applications are being received every year? And we see that there is a slow there is a good amount of progress in 5 years. Okay, so this you can analyze with the line diagram. And of course, faculty qualification, you can see from this histogram that you have to improve upon your PhD numbers because you want the quality of the faculty to improve. So these things can also be used to project to the higher-ups or to the stakeholders that where we are having problem and what we should do. This was very interesting Pareto chart, and these are all not very tough statistical analysis. Simple Excel has got all these graphs, and it's very easy to use. Here I worked out, it is a fictitious situation which I worked out. I wanted to know what could be the reason for the students coming late for the class. Okay, so we are taking a feedback from few students, and they say that college bus is delayed, mess food is delayed. I studied late in the night, so I got up late in the morning, vehicle breakdown, and I was unwell, etc. So we looked at the frequency of these answers. So on this aspect of y-axis, we have the frequency of the reasons. Here we have the cumulative percentage in the z-axis. So you put this into the Pareto chart in the Excel, it will give you such bars and it will give you a line, right? So here what I have done is this 80%, I'm cutting the line at 80%. These are the reasons which are 20% of the reasons, the vital few ones, which are the reasons which are very critical for 80% of my problem. These are trivial many. So this, if I have to start addressing these issues, I don't have to start wasting my time on why the student is unwell, why the vehicle is breaking down, can I prevent it, studying late. I need not be focusing on this, right? I can focus on this. So I can focus on two things. This is to do with my day scholars, this is to do with my hostel students. So definitely it comes under the university's responsibility. So I'm focusing on the college bus delay, I'm focusing on the mess food delay. So this is 20%. So what they say is, this is actually, I heard that this is something which happens across globe, across every event, everything that you assess, you will know that roughly 80% of the outcomes come from 20% of causes. So 80% of our problems can be because of 20% of real issues. They called as vital few issues and trivial many issues. So the difference between this and the fishbone diagram is the fishbone diagram will tell me these are the causes, right? I'll have around 120 causes. I don't have to attend to 120 causes. When they put them into the Pareto chart, I can understand that which are the 20% causes that I have to address immediately to get the problem solved. So that's the wonder of the Pareto chart. This one is about scattered plot. Again, this is to show the correlation between two numerical values. This we have used for number of missed classes versus marks obtained. Obviously, there is a positive correlation that you miss a lot of classes, you get less marks. So this was useful. These are all very simple examples which I'm giving, but we can always use it to assess little serious problems. These are all very problems at a very localized manner, but you can take generalized problems and assess. This again was very interesting control chart. We used the control chart to observe the variation in the process, that is patient treating time and waiting time. So we have taken the detail of patient's waiting time and plotted the control chart with this is a required level, this is the upper limit, and this is the lower limit, and we are seeing a lot of variation in the process. This will give us an idea, how do we control these spikes? So what are the reasons for these spikes? So any process can be assessed by the control chart, provided they are numerical data, not qualitative data. So now the question comes, when to use what? Just like any statistics, we should know what statistics to use for what purpose. So similarly, here again, the question comes, when to use what? So we have two concepts. One is we have to identify the problem and we have to do analysis of the problem. So identification as such, any data table, Excel data table is enough for the identification of the problem. Pareto chart is also an excellent way of identifying what is your 20% problem that is causing 80% of chaos. Analysis can be done by histograms, scatter diagrams, and control charts. And this fishbone diagram and trend analysis are something which can do both. They can identify and we can also use them for analysis. So that is going to bring us to the end of the presentation. I would like to conclude on one concept on quality culture. As I said, this is something that has to sink in the entire university or organization. And this quality culture is an organizational culture to enhance quality permanently. And it has two components. One is the cultural and psychological element of shared values, beliefs, expectations, and commitment towards quality. The second one is a structural and managerial element, which I understand as leadership, with defined processes that enhance quality and aim at coordinating individual efforts. This has to embed, it has to sink in, it has to internalize into every organization. And but it's all about change. As I'm saying again and again, this is a continuous dynamic process which has to happen day in and day out. And you know that it takes time. Any change takes time also, it takes efforts also, and to a constant change, okay? And because we are a high stakes profession, we cannot take a chance. So that is why this change is very, very important for health sciences. But when you look at the general tendency towards change, everybody wants change. But if you ask them who wants change, you don't get much answer. Who wants to lead change? You don't have anybody to lead change, because to lead change, it needs a lot of grit and determination. And that is what is needed. And usually in India, we have this concept of aham brahmasmi, right? We don't need leaders because the divinity resides inside you. So you don't need somebody to tell us where to go, what to do, etc. So each and every one of us, if we can become our own change leaders, so the change can happen. So we don't have to look up, he didn't do, she didn't do, so I didn't do. That kind of reasons need not come up, because you are your own boss, your own leader. So change can happen within yourself. As stated by Mahatma Gandhi ji, that you must be the change you want to see in the world. So it is possible to change. With that positive note, I say a very, very big thank you to all the organizers and the audience for staying with me for this much of time. I'm very happy to take up questions. Thank you very much.
Thank you, ma'am. Madam, it was an excellent presentation. All the quality aspect deliberated by you will be of value for all participants. Participants can put your questions in the chat box.
The questions will be read by you, or should I take the questions from the chat box?
Yes, ma'am.
I'll take the questions directly from the chat box.
Ma'am, I will give you the question, ma'am.
Yeah, okay.
Any integrated tool is there to do all these 7 categories as a single one?
To my knowledge, as of now, no. I have not come across any integrated tool. You are talking about the 7 assessment tools, right? I think they are talking about the 7 assessment tools. These are statistical tools, and I have not come across any integrated tool that can be used together, because each tool has got a specific purpose. So I don't know about the integration.
To honor our resource person, we would like to present the certificate of appreciation to Professor Dr. Karnanidhi Usha.
Thank you very much for giving me that honor. Are there any more questions?
Probably I have a small question, ma'am.
Yes, please.
We are sharing the same platform. I just want to know, what are the difficulties you have in collecting data from the various departments?
Okay. So of course, it's a very challenging process where everybody knows that it is very difficult, but we have made it little systematic now. That we are completely going towards e-collection of data. So we have given them a specific template in an Excel sheet in which they have to give the data and the numbers and the data. Documentary proofs, we are now storing it in our own hub account. So anytime we are able to access it in the e-format. So it is very systematic right now. And since we have this quarterly auditing happening, every quarter this data is filled. So it's easy for the departments and the institutes also. Otherwise, they have to pile up years' data and put inside. That is difficult. So this happens in piecemeal. So it is easy for even the stakeholders to do it.
Thank you. Thank you.
Yes, thank you.
Thank you, ma'am.
Thank you.
I would like to call upon Dr. P. Narsimharaju, IQAC Coordinator, Vinayaka Mission Sankaracharya Dental College, to deliver the vote of thanks.
First of all, I would like to thank the Speaker of the Day, Dr. Professor Karunanidhi Usha, Director Accreditation and IQAC Coordinator, Sri Balaji Vidyapith, Deemed to be University, for accepting our invitation as a resource person, and also for being as one among us to present this quality webinar. Thank you, Madam, for your mind-blowing talk.
Thank you. Thank you very much.
Next, I want to thank our Dean, Dr. J. Baby John, who was always insisting on quality in education and also about the outcomes in particular. Next, let me thank our Director IQAC, Dr. Nyansekar sir. He induces quality to the whole university, who also helps us to understand and practice quality. Next, I would like to thank all the university officials, participants of all constituent colleges, and my IQAC team. In addition, I also thank my IT team, Mr. Sudarshan, Mr. Soundar, and Ms. Sudha. Thank you. Thank you, Madam.
Thank you very much for giving me the opportunity. Thank you. Thank you. So I'm leaving the meeting. Thanks a lot.
Feedback form links are shared in the chat box. So please everyone fill the feedback and see the certificate.